Pay-for-performance model in healthcare setting. Introduction. The healthcare system in the United States is considered one of the most expensive in the world, while the quality of the care delivered to patients does not always meet expectations. Thus, the incentive-based pay-for-performance model was introduced into the healthcare system to provide patients with high-quality care and ensure the improvement of health outcomes. This paper considers the pay-for-performance model and the difficulties associated with its implementation. Specifically, it will address challenges in designing a pay-for-performance program and the impact of the model on provider payment reform, healthcare providers, and patients. Pay-for-performance programs. Separate healthcare facilities can utilize different pay-for-performance programs depending on their needs and goals. According to Mathis et al., there are 6 reimbursement schemes, including pay-per-procedure, pay-per-diem, line-item budget, capitation, case-based reimbursement, and global budget. Pay-for-performance can be considered an add-on to these schemes, with its design contingent on their characteristics. As pay-for-performance is aimed at improving the quality of care provided to the patients, the payments through such an add-on program should be linked to quality targets. These might include such objectives as delivering care following clinical practice guidelines, the absence of avoidable complications, or further employee training. The primary challenge in the design of a pay-for-performance program is balancing the advantages and disadvantages regarding conflicting objectives, costs and quality, and the interests of the different stakeholders. Thus, it is crucial to be aware of the advantages and disadvantages of each reimbursement scheme to design a complementary pay-for-performance program. Pay-for-performance impact on provider payment reform. The provider payment reform can be viewed as one of the measures in a catalog of policies aimed at delivering cost-efficient, high-quality care to patients. According to Cattel and Eijkenaar, provider payment reform is paramount in value-based healthcare as it affects provider behavior and improves healthcare system alignment with value and quality. Pay-for-performance models have a meaningful impact on provider payment reform as they are based on specific and measurable aspects of value. In particular, pay-for-performance schemes aim to improve the quality of care provided through monetary incentives offered to healthcare facilities. As pay-for-performance models complement reimbursement schemes established through provider payment reform, they can substantially enhance them and improve the provider experience with them. However, it should be noted that such models concern a relatively small proportion of total healthcare provider payments, indicating that their impact on the payment reform is limited. Healthcare providers' reaction to value-based purchasing programs. Pay-for-performance programs are implemented mainly through the Centers for Medicare and Medicaid Services, CMS. The main pay-for-performance programs initiated by CMS are the Value Modifier Program, the Hospital Acquired Conditions Reduction Program, the Hospital Readmission Reduction Program, the End-Stage Renal Disease Quality Incentive Program, and the Hospital Value-Based Purchasing Program. These value-based programs link financial incentives for providers with their performance. Nevertheless, many healthcare providers have a negative outlook on value-based and pay-for-performance programs. According to LaPointe, the majority of physicians argue that value-based reimbursement programs will negatively impact their practice as well as patient care and experience. Furthermore, many providers reason that value-based care and pay-for-performance models put additional stress on reimbursement rates while creating extra costs to healthcare facilities, including supplementary value data collection, new services, and partnerships. In addition, as reimbursements fall while costs suffered by healthcare facilities increase, many physicians are forced to consider a healthcare merger. Fewer healthcare providers see the benefits of value-based and pay-for-performance programs and believe that such programs will improve organizational profitability. Overall, the reactions of healthcare providers to value-based and pay-for-performance programs are mixed. Pay-for-performance patient benefits. Pay-for-performance programs can be of substantial benefit to patients seeking medical help. Specifically, they are associated with increased patient satisfaction, improved health outcomes, and reduced costs of services provided. Furthermore, pay-for-performance models are associated with enhanced continuity of care, longer appointment times, and the development of a better physician-patient relationship. As healthcare providers aim to improve the quality of care, as it becomes the central factor considered in reimbursement schemes, the care they offer becomes more patient-centered, resulting in better patient outcomes. Nevertheless, Shakir et al. Suggests that pay-for-performance programs benefit a limited number of patients and contribute to health disparities. Research shows that care for minority patients more often results in poorer quality metrics, leading to the risk of financial penalties to healthcare providers and the risk of such patients being refused care. Thus, although pay-for-performance programs are associated with significant benefits to patients, the risk exists of some patients not receiving care. Conclusion. In summary, incentive-based pay-for-performance programs aim to link healthcare provider reimbursement practices with the quality of care they offer to their patients. Such programs supplement healthcare reimbursement schemes and ensure they are based on measurable quality and value targets. Although the impact of pay-for-performance programs on provider payment reform is limited, the provider responses to their implementation are mixed, with the majority of healthcare professionals having a negative outlook on pay-for-performance models. However, such programs present several benefits to patients, including enhanced health outcomes, patient satisfaction, and reduced costs.